As coronavirus concerns grow, people are wondering how insurance companies will cover the virus. Good evening, I'm Jennifer Griswold. Another concern, being able to stock up on necessary medication if a quarantine prevents you from heading to the pharmacy. This afternoon, President Trump sat down with leaders in the industry to discuss the options. Reporter Phil Bergman went out to learn more about what is covered and what people can do to prevent panic.
With the spread of coronavirus continuing to cause concerns, it's important you're aware of your insurance options so you don't break the bank while determining if you have the disease.
It's actually crazy because a lot of people are worried about it.
Edwin Garcia is an insurance broker in Omaha who specializes in healthcare policies. He says most insurance companies are now covering coronavirus testing, including coinsurance costs.
Anything that has to do with the testing, they want to get it right diagnosed from you.
But don't expect any and all medications to be covered during this pandemic.
It's not something that they will provide you extra stuff just because you're worried.
And make sure you have adequate supply, at least a 2-week supply of your medications. And if you don't, contact your pharmacy to get that supply.
Marty Feltner is a pharmacist at Kohl's RX on 50th and L. He says there's still high demand for face masks and hand sanitizer.
Phones are ringing off the hook, and unfortunately, we're waiting for our back order shipments to come in.
But it's not just these two items they're asking for.
Starting to get phone calls like, do I have enough medication for the next week or two?
Currently, pharmacists can refill up to 90-day supplies on certain medications. If people are in need of a medication and insurance is causing issues, Feltner says there are ways around the problem.
If the insurance denies the claim, we can always call the insurance company and get an override for that patient.
And if you require prescription medication, work with your local pharmacists and make sure that you have valid refills.
We will help that patient out get an adequate supply of their medication just to prevent any disruption in their supply, because the main thing is we want to make sure we continue to treat their disease state.
Reporting in Omaha, Phil Bergman, 3 News Now.
We reached out to Blue Cross Blue Shield of Nebraska. They told us they are offering diagnostic testing for the virus at no cost, offering free telehealth for members, and are working with area pharmacists to make sure members can get proper amounts of medication.